Antimicrobial resistance is a growing concern for both animal production and food safety. But how exactly does AMR develop in the context of animal farming, and what are its impacts on public health and the food supply chain? Let's take a closer look. Antimicrobials are very important in animal production, helping prevent and treat diseases in animals. However, their use can lead to resistant bacteria entering the food supply, creating hidden risks for consumers. This improper use of antimicrobials in animal farming may lead to the spread of antimicrobial-resistant bacteria. These resistant bacteria can then colonize food animals, contaminate food, and potentially affect human, animal, and environmental health. Resistant bacteria in food can lead to infections that are harder to treat, such as outbreaks caused by salmonella resistant to multiple antibiotics. These infections can result in prolonged hospital stays, higher medical costs, and even death. In poultry farming, for example, antibiotics are administered under veterinary supervision and are typically added to the animal feed through a prescription-based system to ensure responsible use. Strong biosecurity measures can prevent the introduction and spread of diseases and resistant bacteria in animal farms, reducing reliance on antibiotics. However, when resistant bacteria are introduced in the animal-derived food supply, the journey of AMR can involve multiple stages. From farms to slaughterhouses to grocery stores and home kitchens, resistant pathogens can spread throughout the food supply chain. Advanced testing methods are used to detect AMR pathogens in food, but despite this, contamination can often go unnoticed until it causes health issues. The economic costs of AMR are profound, from reduced productivity and increased healthcare expenses to potential trade restrictions on food exports. Veterinarians and industry professionals must promote the responsible use of antibiotics. This includes limiting their use to necessary treatments and preventing unnecessary prophylactic use. Policymakers and industry leaders play a crucial role in curbing AMR by establishing regulations and implementing practices that limit excessive antibiotic use in farming. In the poultry industry, regulations ensure that when antibiotics are used, they are carefully selected under veterinary oversight, prioritizing those not considered essential for human medicine. Still, despite these regulations, AMR remains a global challenge. Resistant bacteria can travel across borders through international trade and the global food supply chain. AMR outbreaks linked to antibiotic-resistant bacteria in poultry led to increased efforts from public health agencies like the CDC, WHO, and FAO. These organizations work to track and control the spread of resistant bacteria, provide health guidelines, implement surveillance systems, promote safe food handling, and encourage responsible use of antibiotics to reduce the risk of foodborne illnesses caused by resistant bacteria. Consumers also play an important role in fighting AMR. By following proper food safety practices, like cooking meat thoroughly, practicing good hygiene, and preventing cross-contamination between uncooked meat and foods that will be consumed raw, we can limit the spread of resistant bacteria. Tackling AMR in animal production requires a collective effort. Through the implementation of responsible farming practices and consumer awareness, we can safeguard our food supply and health for the future.